Good afternoon. This is Group 5, and our topic is medical ethics, presented to you by
Brian,
Kante Major.
Lisa Maxwell,
Tiffany Moss, Lanique Rowell,
and Anthony Winston. Our agenda for this presentation is our introduction and background of medical ethics, followed by founder of medical ethics and contemporary authors. Next, we'll introduce you guys to the 4 pillars of medical ethics, which are beneficence, non-maleficence, autonomy, and justice. Then we'll go into ethical importance and the central focus of medical ethics, followed by central questions and criticisms of medical ethics. And we'll end by discussing whether or not the theory is still relevant and whether or not there have been other theories more successful.
Introduction. What is medical ethics? Medical ethics is the clinical ethical part of a broader discipline of bioethics. Medical ethics is known as a group of established agreements that distinguishes between right and wrong in the medical field and in many different facets that fall under the medical field. Further, medical ethics is concerned with the obligation of the doctors and other medical health professionals, such as nurses, and the hospital to patient and the patient's rights. Founders of medical ethics. Hippocrates. Hippocrates was an ancient Greek philosopher and physician. He is credited with being the father of modern medicine. Hippocrates founded the Coan school at Kos at 430 BC. He separated Greek medicine from superstition, magic, and religion, all practiced during that time. Hippocrates and medical ethics continued. His legacy is the collection of treatises known as Corpus Hippocraticum from the 5th and 4th centuries BC. It comprises not only of general medical practice, but also of his opinion on the professional ethics required by physicians and medical professionals. The Hippocratic Oath, as we know today, was taken by an ancient and medieval doctors, which required high ethical standards from physicians. Its principles are important in the profession and ethical education of medical doctors and medical professionals, even to this day. Other contemporary authors are Mr. Thomas Percival. Percival was an English physician. He is credited for having conceived and produced his heritage book, Medical Ethics, in 1803. This book was adopted by the American Ethics Association in 1847. Percival's Code of Institutes and Precepts reformed the professional conduct of physicians and surgeons in private and/or general hospital practice. Additional contemporary authors are Beauchamp and Childress. These 2 American philosophers are credited for their book known as The Principles of Biomedical Ethics. This book is a classic in the field of medical ethics. The first edition was published in 1979. During its publishing, it unleashed the 4 principles of respect for autonomy, non-malfeasance, beneficence, and justice. These principles were said to be the mid-level principles that substantiated a bridge between high-level moral theory and low common morality in medical ethics.
the 4 pillars of medical ethics. Beneficence, doing good, non-maleficence, to do no harm, autonomy, patient rights to make decisions regarding their medical care, and justice, ensuring fairness and justice for all.
Beneficence, to do good. Beneficence is a core principle in the medical ethics field that serves as a guide for medical professionals to act in the best interest of their patients. This principle goes beyond not just causing harm to the patient. Instead, it compels the practitioner to seek out ways and means to ensure the patient's well-being and best possible outcome. Beneficence helps the medical professional answer these questions. Will this option resolve the patient's medical problems? Is it proportionate to the scale of the medical problem? Is this option compatible with this patient's individual circumstances? Is this option and its outcome in line with the patient's expectation of treatment?
Non-maleficent. This term means to do no harm. This term was first coined by American philosophers Beauchamp and Childress. According to the University of Phoenix, non-maleficence means that a nurse or healthcare professional must choose the correct intervention that will not harm the patient but is most beneficial. The actions taken by the nurse should be justified by ethical and professional judgment and guidance. Non-maleficence is the obligation of a physician or healthcare professional not to harm the patient. This further supports that those in healthcare should seek not to kill, to cause pain or suffering, not to incapacitate, not to cause offense, or to deprive others of the goods of life. And here we have the moral ethics related to non-maleficence. We have to not kill, do not cause pain, do not cause suffering, do not incapacitate, do not cause offense, and lastly, to not deprive others of the goods of life.
Autonomy. In medical practice, autonomy refers to the principle that competent adults have the rights to make their own decisions about their medical care based on their own values, beliefs, and preferences. In medical context, autonomy means patients have the rights to informed consent, which is the right to have consent to any proposed treatment or surgery, refuse treatment, which is the right to refuse treatment even if it may cause adverse effects or even death, confidentiality, which is the right to confidentiality regarding their medical information. Overall, autonomy is central to medical ethics because it focuses on patients' individuality and the rights to control their healthcare choices. What is justice in bioethics? Justice in bioethics is synonymous with equality. To be equal is simply to ensure that no one is subjected to discrimination or believes that they are being signaled out. It is granting someone what is justly theirs. This helps to ensure that no one feels as if they are being taken advantage of because of favoritism. The medical court describes justice as being the principle of weighing whether something is right or not, seeing if it is compatible with law, the patient's right, whether it is fair and balanced. The role of justice in medical ethics is to perpetuate capitalist hegemony. Capitalism can be condemned when it is carried to its protectionist or globalizing extremities, resulting in obvious injustice, but the phenomenon itself is not questioned. Ethical importance and central focus of medical ethics. Ethics are the principle that guides us to make a positive impact through our decisions and actions. According to K. Ken Modi, medical ethics is important because it provides privacy, confidentiality, and truthfulness in doctor-patient relationship. The central focus of medical ethics lies in the fundamental principles and values that guides the practice of medicine and healthcare. These principles include autonomy, beneficence, justice, honesty, and confidentiality.
Some of the central questions and criticism of medical ethics include for autonomy, how can the freedom of a patient to choose their own medical care be upheld while also guaranteeing that their choices are well informed and grounded in a clear comprehension of the circumstances? For beneficence, How may medical professionals most effectively strike a balance between their moral obligation to treat patients well and the possibility of injury or unforeseen repercussions while making treatment decisions? For justice, given the scarcity of resources and the conflicting demands for care, which values ought to direct the equitable allocation of healthcare resources? For honesty, the central question based on this is how can healthcare providers balance the duty to be honest with their patients about their medical condition and treatment options, while also considering the potential impact of such information on the patient's well-being and mental state. For the confidentiality, we look at what are the boundaries of patient's confidentiality, particularly when it comes to situations where sharing information is mandated by law or could avoid harm to others. Central question, the idea that medical ethics founded on the concepts of autonomy, beneficence, fairness, honesty, and secrecy may not sufficiently handle contextual and cultural differences in values and beliefs is a major critique of these principles. For instance, the emphasis on personal autonomy could conflict with some cultural viewpoints that place a higher value on informed decision making. Furthermore, the principles might not adequately take into consideration the power imbalances that exist between patients and healthcare providers, which could compromise the autonomy concept. Critics also contend that these moral precepts might not go far enough in addressing more significant structural problems in healthcare, like youth unequal access to and allocation of resources, which might have an impact on the precepts of beneficence and justice.
Is this theory still relevant, and have other theories been more successful? According to Immanuel Kant, a German philosopher, deontology is an ethical approach centered on rules and professional duties. Kant's moral theory is based on his view of the human being as having the unique capacity for rationality. With that being said, the theory of deontology, which encapsulates beneficence, doing good, non-maleficence, to do no harm, autonomy, giving the patient the freedom to choose freely where they are able, and justice, ensuring fairness. This theory does remain relevant today as each of these are a continuous duty. And while the virtue theory is often mentioned as well when the deontology theory is being spoken about, most would agree that the theory of deontology is the superior theory. According to Brandon Robin, this is because the theory of deontology does not require rules as the virtue theory does.
In closing, according to Beauchamp and Childress, medical ethics, also known as clinical ethics, is part of the broader disciplinary bioethics as discussed earlier. It is a structured approach to ethical decision-making in medicine and used to help guide choices about medical care. Medical ethics can help to identify, understand, and resolve ethical issues that arise in patient care by helping to clarify why certain actions are right and wrong. Clinical ethics uses ethical reasoning and the application of bioethical principles to resolve these ethical questions. Thank you for watching.